If you've recently tested positive for COVID-19 or you're waiting on your test result, well, News 18's Perry Apostolakos has guidance from a local health official on what to do next. Perry, I've gone through this myself, and it kind of seems that the official CDC guidelines have been changing.
It seems like it, Cody. I spoke with Tippecanoe County Health Department Administrator Khala Hochstedler. She says the seemingly ever-changing guidelines have been difficult for the health department, especially as the positivity rate here in Tippecanoe County rises higher than it's ever been before. Hochstedler says the guidelines are different depending on whether or not the person attends school or work where a mask mandate is in place. If there is a mask mandate in place, the CDC recommends a 5-day quarantine after a positive test result, with precautions taken until day 10. If there is not a mask mandate or masks cannot be worn, Hochstedler says the previous CDC guidelines still apply, with a 14-day quarantine with a 10-day isolation after a positive test result. The difference between isolation and quarantine is that isolation should happen after a positive result or when symptomatic and waiting on testing results. Quarantine is what is done when someone has been exposed to the virus. Hochstedler sympathizes with the concerns of those who are trying to return to school or work, but says these are special circumstances.
And it is hard, and it's putting a strain on us also. But at the end of the day, it's with Omicron being so infectious, we can't risk that.
Come back here to News 18 this morning tomorrow for continuing coverage. We'll be hearing from a local in the early child care industry on the impact these guidelines have. Reporting in studio this morning, Perry Apostolakos, News 18.